program, we dey look at understanding your liver, protecting your life. Stay with me for the next 1 hour inside this program. We pray now in the name of the Father, and of the Son, and of the Holy Spirit. Amen. Papa, we want to tell you thank you for the gift of life. We tell you thank you for how far you don't pull we to today. We honor and glorify you. We thank you for everything, for all the favors, for all the graces. I commit this program now you on, viewers and listeners now you on, and let take you through the session. Make all this prayer to Christ our Lord. Amen. Family members say you they get we live now we 90.9 studios na Freetown 101.3 na Makeni 91.7 na Bo and 90.7 na Kenema. And you same way so can add your voice to the program, or same way so can support the radio in cash or in kind, as the radio depend on divine providence. That's 079-900-907 or 077315147. Of course, me where they be in the mic for the Word Body Talk program, me na Gifty Masako. Inside today your program, we go get the opportunity for get an introduction, look at the global burden of hepatitis, and also look at hepatitis in sub-Saharan Africa, of which Sierra Leone are part. We look at the Sierra Leone context. We try for see waiting the liver they all about, and waiting at the difference between acute and chronic hepatitis, the risk factors, the complications, the types of hepatitis, the risk factor for the different types of hepatitis, how then they diagnose hepatitis, the lab test, the prevention, and also inside salon you go access hepatitis services by how you go get the vaccine, the testing, and how they go treat and refer. Then same way so call to action and the key messages where we go get and the take home points there. So the program long, but let me see how it go inside this 1 hour. As I say, me na Gifty Famble them, and welcome to the Word Body Talk program. Today we go discuss this particular condition where na hepatitis. We want for understand them. We same way so want for protect we liver, and same way so want for protect we life. They often they call it the silent epidemic, because many people they live with this sicker where they call hepatitis for years without they don't know say they don't be infected. Same way so hepatitis na major public health problem all over the world, which salon na part of them. The same way so they affect millions of people them, and it will lead to serious illness. It will lead to at times disability, liver cancer, and death if they not detect or treat them early. All these now references from World Health Organization. Then we look at the global burden of hepatitis all over the world. They say approximately 254 million people they live with chronic hepatitis B infection. According to Lancet, there are approximately 50 million people they live with chronic hepatitis C infection, and more than 6,000 people they become infected every day. More than 6,000 people they become infected every day. Hepatitis they cause about 1.3 million die every year. And hepatitis B, they account for approximately 83% of the hepatitis-related deaths, while hepatitis C, they account for about 17%. So that's not the figures them where they tell we how serious this be and why they consider them for be a global burden. And now let me look at this condition inside sub-Saharan Africa. The one don't get just now all over the world where we say globally. Now we look at the burden of hepatitis now sub-Saharan Africa, of which salon na part. So sub-Saharan Africa they bear one of the highest burden of viral hepatitis globally, particularly the hepatitis B. The World Health Organization African region, they continue to face significant challenge in testing, for diagnose, for treat, the access, and also for prevent mama to pikin transmission. Yes, so we get major challenge where include low awareness. Plenty of we not even know if hepatitis dey or wetin na im. We get low awareness, though some people know, or even if some people know, challenge dey say something dem not even go for the market. Then we get inadequate, available, but we get inadequate hepatitis screening, and we get limited treatment available. Then we get low hepatitis B back dose coverage. Then we get mother to child transmission, and then weak surveillance system. This na the one wey dem say na the major challenge na sub-Saharan Africa. So many people dey unaware, and then they become infected, and it go move to advanced liver disease before dem even know say dem get this problem. So now let me look at the Sierra Leone context. We don't come up from all over the world. We don't come to sub-Saharan Africa. We get a major challenge. We don't come out to all over the world until we approximately the million people that we don't be affected or infected in one way or the other. Then now we look at the Sierra Leone context. In Sierra Leone, hepatitis also remain important public health issue. Then although progress don't be made through the expanded program on immunization, when EPI, they don't improve blood safety measures and infection prevention initiative, yet challenges then still they exist, because we still need more public awareness, delayed diagnosis. It depends when the people can go to hospital, because we know the number of doctors to thousands of patients there. So a very challenge for the doctor go after you for the venue. So we get low public awareness, we get delayed diagnosis, we get stigma, we get limited specialist services, and we can get inadequate routine screening among high-risk groups. Therefore, we need for increased awareness testing. We need for increase awareness. We need for increase testing for day. We need for increase vaccination day. We need for also promote early treatment, where from remain national priorities. And of course, we know say that one and they all na key na the agenda for the Ministry of Health, especially in this 300 days of activism where they go on, where they look at the 000. So now with all of these hepatitis, the word on the come say, let we understand hepatitis, let we protect we liver, and let we protect we life. So with all that short introduction we are doing with the context globally in sub-Saharan Africa and in Sierra Leone, we all on tell we but say we get challenge. Even though the support there, even though EPI there, even though they don't give vaccine, even though they don't screen, even though they don't do awareness, yet we still get more for be done. So we need for understand the liver. And recently in July, of course, they observe World Hepatitis. They went at a time for raise awareness for people them for no say sick like this day, and a very serious and a thing where you as individual get your role for play, as a family, and everybody get in your role for play. So for sake of that, we go want for know this hepatitis waiting in the ambog. We get one organ of the body internally where it very big. So that one the word the hepatitis divide into two. Of course, the first part of the word hepatitis, we don't say the hepat, they tell we about the liver. Then the itis, they tell we say na inflammation, where they tell we say something wrong with the liver. But however, we need to understand waiting na this liver before we go to where the liver get problem. Let we look at first where the liver well, how we turn like waiting and enroll and all of them one day. So before we discuss hepatitis, as I say, important for let we understand waiting at the liver. The liver is the largest internal organ of the human body, and same way so locates na the upper right side of the abdomen, just beneath we ribs them. The liver they perform boku essential functions, and out of these essential functions, it include they filter harmful substances from the bloodstream. They filter, they serve as shifter. They filter harmful substances and toxins from the bloodstream. The same way so they produce bile for help digest fat. Bile normally we can say, hey, where is it? You say something kind of me want bitter come. So normally people can say that bile are bitter. So the liver they produce some why, because it help for let it digest the palm oil they eat, the oil they eat, the butter they use, the mayonnaise they eat, all of them fatty things, and the bile they help for digest them. So the liver now in the produce them. Same way, so the liver it get role for filter, it get role for produce, it get role for store, it get role for process, it get role for regulate, it get role for support. So it get all of them roles there, so where they play. And as much as they filter harmful substances where they come na the body, they try for filter them from the bloodstream. The same way, so they produce bile, as I don't say, where they help for digest the fats, all the fatty things that we they eat in we food. The castor leaf where they eat when a permanent and cook out, or when a oil and cook out, or the bread where eat with butter, and all of them, the all thing way pertain to fat, a get for digest, and for let digest, you need bile for be produced by the liver. Then same way, so the liver they store vitamins, you know, so get vitamin A, B, C, D, E, and K. So it store vitamins and minerals and energy reserve. So it reserve the energy. You can wonder why some person go say they go 21 days fasting, they go number of days fasting without eat and all, because this liver gets involved with all what they eat, where the body don't use all it take the reserve where it gets na day they go keep them for let able to tell where the body need them for let it convert them back. Can go keep them into some trading called glycogen, where the body need as fuel, convert them back to glucose. So it also they produce protein where we need for blood clotting. Many a time with a cut, you go left the cookie as soon as you cut your hand with nerve and all of that, or you do something, you mistake cut yourself with nerve and all of them thing, and there is a blade. At the end of the day, you go see say after some time that blood will be they ooze out, you go find something where they come a seal and all of the one, and they all that now because of the thing where they be produced, where they help for blood clotting. It also they help for regulate with blood sugar level. It also they process medications and alcohol. Then also you can find out say most people they can say not take too much of Panadol, it will cause too much, it will except now one drug which can affect the liver and all of them one, and then too much alcohol, them people can take too much alcohol, some are not go eat better and all of that, and they take very very high percentage of them hard liquor them. Then also it supports the immune function. So because the liver they perform so many vital functions, as I say, they store, they produce, they process, they filter, they regulate, and all of these because they support, they perform all the many vital functions there. So damage wey caused by hepatitis will affect almost every organ system na the body, because the liver they play a greater role. They play a greater role. You don't see say the first one, they filter harmful substances and toxins from the bloodstream. So if for any reason this liver become infected or become inflamed, any of small problem do it cause damage, it will affect almost every organ system na the body. So the word hepatitis simply means an inflammation of the liver, and it can be caused by tumbu, what we call virus, and also at times they will say excessive alcohol use, certain medicines them, as I say, one can be Panadol, then toxins or autoimmune conditions. However, the most common forms globally all over the world, the most common na viral hepatitis. You get A, B, C, D, and E. So among them one there, so hepatitis B and C, then say it account for most cases of chronic liver disease, cirrhosis, liver cancer, and hepatitis-related death worldwide, according to World Health Organization. So according to them also, say approximately 340 million people they live with chronic hepatitis B or C inside 2022, and about 1.3 million people don't die from hepatitis related causes, where they make hepatitis one of the world leading infectious disease killers. One of the world's leading infectious disease killers. So fumble them now the foundation that we are only let we know say hepatitis globally it cause challenge. Sub-Saharan Africa, even in Sierra Leone, will not be exception. And we get these 5 types, and we don't know the importance of the liver in role where they play as an organ, and where this tumbu affect them. We get them different types. Then so So family, you will just join in. We dey look at understanding hepatitis, protecting your liver, and protecting your life. This na Well Body Talk, where they come to you live from Radio Maria Salome, the Christian voice. Now you host with me, Gifty Masako. Inside the beginning, we don't look at the global burden. We don't look at hepatitis. Now sub-Saharan Africa, we don't look at Sierra Leone context. And same way, so we don't try for understand the liver. Now we go want for know. In the beginning, I mentioned something about chronic. So now we go want know waiting at the difference. Hepatitis, it can either be acute or it can be chronic. So now we go want for know waiting at the difference between acute and chronic. So when we say acute, it means saying a short-term inflammation of the liver where they last less than 6 months. So people with hepatitis wey acute, then go experience fever, or go say one body, you go experience fatigue, you go experience weakness, you go dey feel for vomit or you dey vomit, you go lose appetite, you go complain abdominal pain. At times where e dey wet, you go get dark urine. Some can say the urine sometimes fever like a coke. Then you go get pale stool. If only you know somebody where you pass your stool, you always dey watch am. You go see say e pale. Why e pale? Because I don't tell you say the liver dey play role with the bile wey dey produce for help for digest fat, but wherein the liver get issues, them the bile no dey perform that role there. And no more you eat the palm oil, how you eat the oil, how you eat the butter, the cheese, and any of them fatty thing, na so e dey pass back na the stool. So you find out, so you go see am like say a pale or clay colored stool. So na like that because the fat no don't digest. The more reason why anybody can get problem with liver, then can advise them for let avoid fatty food, so it will allow the liver for make a rest. So that's now for acute. We say a short-term inflammation of the liver, and it dey last less than 6 months. And so people with can experience any of them signs here. Was it might not be saying that all go happen, but it's possible for like get fever, it's possible for like get fatigue or weakness. Maybe can get 2 or 3 of them signs or symptoms here and all. It's possible for like feel for vomit or a vomit, or you get loss of appetite, especially at times when they see them fatty foods, you know, they feel for it. They lost appetite, they get abdominal pain, the urine, then the stool they pale. Then one key one mostly, whether you tell the well body workman or not, or even somebody where they with you now, also go be very observant where you go take note of now the yellowing of the eyes and the skin. When I can make it be specific, then say the person get jaundice. So if you go to hospital, say doctor, look at that one day, you can just need more that follow up. So plenty people they recover completely. They say plenty people will get the acute hepatitis, then at the short term where they last less than 6 months, and say they can recover completely, particularly the one that we get hepatitis A and hepatitis E. As we go further, we go get for know the different types, as I don't say A, B, C, D, and E. But here we they look at hepatitis for say it can be chronic or it can be acute. But now we don't look at the acute for say now one way they did in shorter term, way less than 6 months, it can present or the person can experience any of them signs of fever, fatigue, as the case may be. So we now look at chronic. When we say the person gets chronic hepatitis, we don't say acute, na short-term inflammation of the liver where they last less than 6 months. But now chronic now, it occur when the inflammation of the liver persists for more than. With acute, in less than 6 months, but for chronic, in more than 6 months. And waiting in associated with, it commonly associated with hepatitis B, hepatitis C, and hepatitis D. So chronic infection, they remain silent for many years. No wonder at the beginning they say itself na a silent condition. Just as they can say hypertension a silent killer, then go say glaucoma na silent thief of sight. So likewise, hepatitis self gets in silencing now. So because it will be silent for many years. Whilst it is still silent, yet it get progressive liver damage where they occur. So eventually it will result in failure of the liver. It not able to do all them functions. So I be don't say they produce, it protect, it filter, it support all of them functions, and it will get challenged for them. So now we look at the one that we get risk factor. We don't say it can be silent, and when it be silent, yet still something they go on where you don't know. By the time you they know water don pass flower, e don progress to liver damage and some other things dem. So wetin are the risk factor wey e don pass acute stage wey na less than 6 months, I don go to chronic stage wey na over 6 months. So the risk factors for let somebody wey get liver problem go to chronic na wey e get delayed diagnosis. Maybe today you sick, you fit say no more, all day you say na malaria, na typhoid, na so no more, you just dey go buy medicine and you go let them go do test for you for make dem really know wetin, how the liver dey function. You know, if dem delay for diagnose am, it might be a problem. Until that time wey you don take note of now, you don pass 6 months and all. Then also lack of treatment. Maybe dem don put you on treatment, you no complete the treatment, or because you don delay for diagnosis, you no don dey take the treatment. Then with all of this, sometimes you still dey take heavy alcohol. Then possibly alongside this chronic liver disease, wey mean say e don pass 6 months wey you don dey go through am, then e be say you get co-infection, possibly HIV, or you get diabetes and obesity. Then also that na risk factor. Then also long standing, somebody don get hepatitis B for long, or you don get hepatitis C infection for long. Then dem say about older age na risk factor. Then male sex na risk factor according to wetin studies prove. So also somebody wey dey with chronic hepatitis, dem say possibility dey, the complications without treatment, hepatitis go lead to permanent scarring of the liver, permanently. So imagine all the functions wey I name just now, the liver no go able for do am, wey e don reach to the level of cirrhosis, wey mean say na permanent scarring of the liver. Then also another complication can be liver failure, wey mean say the liver dey lost in normal function. Another one can be also raised pressure within the liver circulation. So some person can get, they can go take in pressure high and all, but they don't look some other reason. But when they do some other things, they don't find out some people and the pressure can high, but when they can go check, maybe some reason, maybe na liver problem again, or some na kidney problem. So any of them thing there might be, when they control, I find out say that person pressure can become normal. So then they say complications of chronic hepatitis also can be portal hypertension, when I raise pressure within the liver circulation, or it also can cause fluid accumulation. The belle go big. See, I say this Italic say na belle get more man, they go see that in belle big, when na ascites, we mean say na fluid na in the abdomen. Or they can get other way, they call so esophageal varices. That one they normally now where you they get the vein them, you get swollen veins where go easily bleed. Then also you can get confusion, where can be caused, the person could become confused. Why? Because of you don't get toxins, something and then at the body where the body no need. Where if the liver be really they work, it they filter. Remember the first function was in a filtration. So if you're not able for filter some of them toxins there, so in the circulation for they able for make the blood and the blood pH and all of the other things they are continue for do their normal work, you get possibility for may lead to confusion because of you don't get hepatic encephalopathy, where because of this liver problem it cause some problem na the brain itself. Then also especially it can cause liver cancer back. Then at times it will lead to death, because then complications they are particularly common with chronic hepatitis B, C, and D infections. So we don't see where it chronic. So if somebody get hepatitis when it in the acute phase, we mean say from where you get them to less than 6 months, now acute phase, and if you go in for the treatment, it go able for go far. But if you take over 6 months, there is still no know, then yet progressively the liver they become damaged and all without know. And if you delay for go for diagnosis or for go for treatment and all of that one day, it can lead to other some problem. And one of the key one will be where the organ they fail, the liver they fail for doing work, all the other key functions there at the end of the day it will be challenged. So with this one we don't look at say the liver again role for play na big organ na the internal part of we motorman them, and same way so the liver, if it become infected when a hepatitis, it can either be acute or it can be chronic. And if we say acute, na short term, and it can dey less than 6 months. And if we say chronic, that means say the sick don dey pass, you don pass 6 months. Sometimes the tell when you detect am, e don delay, and because when you go don detect am, e don delay, possibility say some other problems be don dey go on wey you no know until you go do so many tests dem, then the doctor go able for identify am. So now we go one for know, you see say during the explanation of acute chronic, the letters of hepatitis, they come up A, B, C, D, and all. So now we want specifically look at the types of hepatitis. Even though we don't say it can be acute or chronic, yet where it is acute or where it is chronic, yet it still gets in letters the way it fall under. You get some hepatitis where due to the kind water wey they drink, or where it be to the kind food wey they eat, or maybe the blood, or well body work. You get all of this. So it categorized under A, B, C, D. So now I go on now we take with time. For let we look at 10 different types of hepatitis here. I sure say I try for do one in a way we go able to understand. We get hepatitis A, we get hepatitis B, hepatitis C, hepatitis D, and hepatitis E. So we get 5 types, and then 5 types here. So it possible say then can be acute or then can be chronic. And if it be chronic, it could be very challenging because it go don pass 6 months and it go don dey do some other things into this master organ. We get so many work for do for we na the body wey go be challenging that if even you wound for like you clot, it not go easy for you again. So many of the other functions as I be done, they name them. So now we go and look at the types of hepatitis. As I don't say, we go and look at the type of the hepatitis, waiting the cause them, and waiting at the mode of transmission, how somebody they catch them, whether they are at risk for this type of hepatitis, then how long it take for let the person begin see any of them say why they don't tell they feel weak or they feel tired and all of that, or they see in stool in color change or in body in color change. Then also if that particular type dey, if na one way acute, or if na one way chronic, or na one way go be acute, or na one way go be chronic, or na one way go fall na the two side. Then also it go be the common symptoms them, and also other than the high risk, the waiting normally can be the major complication. Then this particular letter of hepatitis, it get maculate for am, and all of these. Now till then go men or e no go men, and how for prevent am. So I go one where we look at that one day. Remember, say this now Body Talk, where they come to you live from Radio Maria, the Christian voice. Now you also Body Talk. Today we want to look at understanding hepatitis. We also want to see how we protect we liver and how we protect we life. Since the liver now very big organ and the one largest one inside the body. So we look at hepatitis A. Hepatitis A, they say they're all a virus, they cause them virus tumbo, the hepatitis A. What's in the mode of transmission? They say contaminated food and water. Most of the time we all get to the buy cookery in our streets, or something how we say they prepare our food, you know what, we food fine, especially then leafy foods them raw thing they will want for it to know what's them well. So they say mode of transmission, you can get hepatitis A when the food and or water contaminated with the hepatitis A tumbo. If the hepatitis A tumbo dey pan the water or pan the food, then you take that food day, you get tendency for me you get them. Other than they at risk for letting get hepatitis A. Now the one that we get poor sanitation. Poor sanitation, the one the way then water the way then they get enough safe, then they get poor hygiene. So waiting at the incubation period, now between 15 to 50 days. So you see inside 2 weeks to close to 2 months, not even 2 months because now 50 days. So 2 weeks up to 1 month 20 days. You go don begin get some of the signs. Then now it go begin tell you now say now so and so yes na acute infection because it less than 6 months. E not able for move to chronic infection. And common symptoms, the person go get fever, he go say they feel for vomit, or he go feel tired, then he go get jaundice. So you go find out say in all of these jaundice cut across. So that yala he cut across the specific thing go make them know say this type of hepatitis e get or na this other type of hepatitis e get, na by how e go get e give explanation to the doctor, and same way so na by how dem go send am na the lab go do the test, and the test show say na hepatitis A or na hepatitis B. Is specific about the letter, then dem go know which type of hepatitis e get. So as I say, hepatitis A, the mode of transmission, how you dey get am na through contaminated food and water, and you wey dey at risk na you wey get poor sanitation, unsafe water, and poor hygiene. And also the incubation period now around 15 days to 50 days, then you go begin for get any of them sign here for say you get fever or nausea or fatigue or jaundice. Then of course na acute infection, and sometimes they say it can some ten a day it can be asymptomatic. They say some 10 a day you go get hepatitis A infection, you no get no symptom, and they call that asymptomatic, so it can dey with no symptom. But at times you go get jaundice or you go feel tired and all of them. And they say other than they at high risk, now people them we get poor sanitation access, then they at high risk. But in reality, no go cause liver failure. Vaccine, they say yes, vaccine dey against hepatitis A. And then in treatment normally, they say it can be supportive treatment. They go tell you for improve on your food, or for practice hygiene, wash your hand, wash your food, wash your vegetables and all of that, and just say you take pure water and all of them thing a day, then go able for tell you. So the prevention na hygiene, sanitation, and vaccination. Now that's for hepatitis A. So now we go to hepatitis B. Hepatitis B now na hepatitis B tumbu dey cause am. A mode of transmission. Remember, A in dey transmit through contaminated food and water. But hepatitis B now, how e dey transfer from how e dey go from one person to the other? They say through blood. And this through blood also through mommy and daddy business. Then through mama to pikin. Sometimes the mama gets the hepatitis B, then e go for born the pikin, e get tendency for pass am to am. So blood key. So in as much as A na food and water, now B in dey but blood, mommy and daddy business, then mama to pikin, wey then go e go for go born. Then how other than they at risk? Of course, one way they do mommy and daddy business, so they not protect themselves. That na one. And you wey no say this person you know, una not don test una self or see say una all too negative, una expose una self. Then you wey dey share needle, then you, especially the needle wey you go don share, then you know say that person infected, they use the same needle. We woman they waking go for go fix with on, then they use needle na you aid, or you man you they go for go barb, you don't know if they if na new blade then they use, and all of them one they also. Then infected blood, sometimes they go for transfuse blood per you, they not screen the blood well. If possible, maybe in case of emergencies and all of that, you never can tell. Then also perinatal transmission. So you get all of them one day. So when then a risk factor, you dey at risk. So because you dey at risk, in if you're not possibly exposed to the needle, you exposed to blood, you exposed to sharp object, especially where body work man there, yeah, you get for take care. Especially the one the way they work na labor ward, the one the way they work na theater, the one they work na outpatient emergencies, they get for take very good care. Then in your incubation period, in as much as vitamin hepatitis A now from 15 to 50 days, yet hepatitis B in your period now from 45 to 180 days. Yeah, so it don't go up to then 6 months already. So now acute infection, yes, but even though now acute infection, unlike hepatitis A, we not go chronic, but yet hepatitis B na acute infection, we mean say it can last for less than 6 months, but yet if you not pay attention to them, it dey become chronic, we mean say it will exceed over 6 months. They're waiting at common symptoms. It get fever, instead get abdominal pain, it get jaundice, then it get dark urine. So now it make motorman. Where you dey pass stool, you get for the watch you stool. Where you wet, you get for the watch you wet, and see you wet in color. Normally, they say we wet for the amber color. And then they too yellow, you not go too pale. Because if you do that, they take and say, oh, this are not doing plenty. If you too concentrated, you say, oh, this are not doing plenty water. But if you get all that color, like you look fever like a coke and all, it can all like this for big concern for you. So you need to pay attention to urine. So dark urine. Then they say it can be asymptomatic. It possible say none of them signs there, so or them symptoms there, so the person not able for experience am, not able for complain saying belle dey hard or e dey feel tired. But we possibly other people can able for see for say e jaundice or if e dey wet and all, but there are times dem say it can be asymptomatic, you no go get at all. Una dem dey at high risk. I don see am already. Well, body workman dem, belle woman dem, sexual partners dem wey get infected persons. Maybe the man get am, the woman no know, the woman get am, the man no know, or maybe they all two not even know, then they all two get am and all. So wetin na your major complications? Hepatitis B, your major complications, e dey lead to liver cancer or liver failure or cirrhosis. Vaccine available for am? Yes. Maclate dey for hepatitis A, maclate dey for hepatitis B. So they can go do the test for make dem check and see if e positive or e negative. Then in your treatment, unlike hepatitis A wey na supportive treatment, hepatitis B in dey give antiviral, dem dey give drug against the virus, dem dey give antiviral therapy wey the well body workman dem go able for administer or tell you for take am. Dem say e usually controlled, not cured. So we get for be very mindful. So no wonder I see in days go that long. Prevention. How for prevent hepatitis B? Vaccine, safe sex, blood screening, safe injections. Dem dey give injections, you get for ensure say the needle new and all. And you self the well body workman, you dey give injections, you get for be mindful for let you no go prick you self. Now we go to hepatitis C. Hepatitis C sef, of course, na the hepatitis C tumbu, the virus dey cause am. Itself how e dey transfer na blood to blood contact. Blood to blood contact. Then other than dey at risk, same like hepatitis B, the one wey dey share needles, unsafe injections, unscreened blood. Then your incubation period na 2 to 12 weeks, wey na almost from 2 weeks to 3 months. E acute, yes. That means say e dey less than 6 months wey e go don hamburg you. It can be chronic, yes. Then in common symptoms, they say often e no dey show you any symptom, but at times e go get fatigue, e go get jaundice. Then also other than dey at risk na people dem wey dey inject drugs, na people dem wey then dey transfuse them with blood. Sometimes dem get conditions wey most of the time dem get for dey give them blood transfusion. Wetin are the major complications? Just like for hepatitis B, self get cirrhosis, liver cancer, or liver failure. Yeah. And for hepatitis C, as at wetin research show ya, say e no get vaccine, but A and B get vaccine wey available. And also they can do in test for look at the tumbu for see if e dey there for make dem confirm the diagnosis. Wetin na own treatment, as A na supportive, B na antiviral therapy dem dey give, but C now himself dem dey give direct acting antivirals. So when you go then do the screening, then do the test, then confirm say na A or na B or na C, na im go determine the treatment wey doctor go give and the advice wey dem go give you. And also they say yes, more than 95% for cure rate. And how we go prevent am na blood safety and infection control. Then now we go to hepatitis D. Hepatitis D sef na the tumbu hepatitis D virus. They say in your mode of transmission, it dey occur only with hepatitis B infection. So in dey occur in partnership, na in twin partner with B. Hepatitis D na in twin partner with B. It dey occur only with hepatitis B infection. Other than dey at risk, somebody wey already get hepatitis B infection, that one wey say e can transfer from blood and mommy and daddy business, mama to pikin. So na the B that one day. Then in your incubation period, itself similar to hepatitis B, wey na 45 to 180 days. Yes, a acute, yes, it can lead to chronic infection, and itself in symptoms them similar to hepatitis B, but in more severe. the fatigue more severe, abdominal pain more severe, jaundice more severe, and the dark urine more severe. They say at times back it can come without symptoms. And the high risk group na people dem wey dey with hepatitis B infection. So B and D dey determine by B. And so in your major complications, dey rapidly progress to liver cancer or cirrhosis. Yes, vaccine available, e dey prevent am through hepatitis B vaccine, and itself dem can do in lab test for make dem confirm am. In own treatment na specialist management. Yeah, then in own cure e very difficult, but however you dey prevent am by how you go take the hepatitis B marklets, and also dem go give the vaccine or try for make you screen yourself. Now we look at the last one wey na hepatitis E. Itself na the hepatitis E tumbu dey cause am. E na contaminated water. Unlike hepatitis A wey na contaminated food and water, hepatitis E na contaminated water. Hepatitis B and D na blood. And also C sef na blood to blood. Then the risk factor for hepatitis E na poor sanitation, just like for hepatitis A, na unsafe drinking water. Then in your incubation period na 2 to 10 weeks. 2 to 10 weeks. Then it can be acute, but for let it be chronic, it very rare. In your common symptoms dem na fever, na malaise. It can look tired, and instead the jaundice. So jaundice cut across the all way na one kit wey body work man go see, or you yourself na the community where you go see and tell the person say your body look yala or yala or when na a signal. You not gonna know the type of hepatitis, whether na A, whether na B, whether na C, whether na D, until you go hospital then do the test, then see this tumbu under the microscope and say now this type e get, and then for me explanation for most step begin getting sign there and all other things where doctor see and how long you don dey feel, and the ten dem go know whether na acute or whether na chronic. So itself your major complications, they say the high risk group na belle woman dem, and the major complication na severe disease wey woman get belle. They say globally in vaccine in availability is limited, e no dey too much. Then also itself the need for do immune test, and itself your own treatment just as for hepatitis A na supportive treatment, whereas hepatitis B then they give antiviral, hepatitis C again, and hepatitis D na specialist management. Yes, hepatitis E is usually self-limiting. Also it dey prevent am by how you forget safe water, sanitation, and hygiene. So family na the 5 types they one and day where we don't look at. We don't see the one where they be caused by food, contaminated food and water, the one where they caused by just contaminated water, and the one where they caused by blood. So we don't know, say na a public health concern globally in sub-Saharan Africa, and of course Sierra Leone not to exception. And we don't see how important the liver dey. So now we go look at the risk factors for different types of hepatitis, because risk factor na anything wey dey increase somebody in chance for them become infected with hepatitis or develop chronic liver disease. So we don't say hepatitis A na the one where mainly they at risk. Now you wey dey drink contaminated water, you dey eat contaminated food, poor sanitation, poor hand hygiene, you dey live na overcrowded conditions, you dey travel to areas where get high hepatitis A virus prevalence according to WHO, and highest risk groups na pikin dem, travelers dem, people where they live in areas where get inadequate sanitation and water supply. So water na life, we get for take care of water, and same way so sanitation we get for pay attention to, because don't know say hepatitis A and E they play greater role in the water and the food we dey take part in. Hepatitis B, they tell we say the main risk factors now unprotected sex, multiple sexual partners, sharing needles, especially infected needles and syringes, on-screen blood transfusion, mother to child transfusion, living with an infected person, healthcare related exposure, well body work man them, tattooing, you where they go for tattoo, you get for be very mindful. Maybe them picking themselves when they go, the boy picking them way then they do circumcision for, or you wey dey go for piercing, you wey wan go give more you wan go give bow you ears, you wan get more than 4-5 years in a year, so you wan go bow you nose because of fashion with unsterile equipment. And one themself wey dey undergo dialysis, wey sometimes get challenge with dem kidney, all of them one dey also dem can be challenged for dey at risk. But the one wey dey na highest risk group for hepatitis B na well body workman dem wey dey play with blood, sexual partners of infected person, newborns of infected mothers, and people wey dey require frequent blood transfusion, dialysis patients dem. Dis na wetin CDC and Lancet tell we. So na the highest risk factor, that one dey. Then hepatitis C, the one wey dey at risk na the one wey dey share needle, unsafe injections, contaminated medical equipment. So well body workman dem we get role for look at after them medical equipment dem, on-screen blood transfusions, needle stick injuries, long-term hemodialysis, HIV infection. Then the one wey dey na the very high risk one, na the people wey dey inject themselves with drugs, healthcare workman dem, dialysis patients dem, and the one wey dey receive blood wey dey not screen well. So hepatitis D, e dey exist, as I say, wey hepatitis B infection, the way somebody don get exposed to infected blood, needle sharing, unprotected sex, the route wey associated with hepatitis B transmission. And one wey dey na highest risk na individuals wey already infected with hepatitis B. Then hepatitis E na contaminated water, poor sanitation, inadequate sewage disposal, mostly where rain can just dey go, some man just go empty in stool and all, e dey go infect others, others can just go brook na the area go get water and all of that, say like was and all of them things, and they was so flooding, humanitarian emergencies affecting water supplies. But one way they at highest risk now, pregnant women, especially during the 3rd trimester, the last 3 months of wey get the belly, and populations where they live in an area with poor water and sanitation system. All of the information there, we get them from World Health Organization. The major risk factor for hepatitis now unsafe water and poor sanitation for hepatitis A and E, and exposure to infected blood, unsafe sexual practices, contaminated instruments, and mother-to-child transmission for hepatitis B, C, and G. So for let we diagnose this, it involve clinical assessment. As I say, the person will come, maybe go see how they feel tired, or how they wet look dark, how they pass me stool, it look pale, and my body look yellow or my eye yellow, all of this, I know they feel for it and all. So then go for do this clinical assessment and laboratory testing. So then go able to identify this tumbu, whether na A, whether na B, whether na C, whether na D, whether na E. Then from all the other history way they don't give, then go able to know if na acute, if it's less than 6 months, or if na chronic, if it don't pass 6 months. And also the healthcare now provider now go try for evaluate all of these through a medical history, the symptoms where they present, the physical examination findings, and also if now somebody where they at risk, as I don't say, maybe they're exposed to some food or to water, or you don't travel and all of that, they can forget all of them things there. So for medicine screen the hepatitis A, B, C, D, and E, and gets the confirmatory test result, and then go able for treat. So let we know say prevention that hepatitis A, not chronic, then can prevent her with vaccine, and same way so we dey encourage safe water and food for let you partake of them, for let you prevent yourself for not forget hepatitis A problem. Then also hepatitis B, of course, vaccine dey for them. You get for practice safe sex, blood screening, and safe injections. And hepatitis C, of course, can be curable with treatment, and then you get for go through blood screening and then safe injections. Hepatitis B, they occur only with hepatitis B infection, and also hepatitis B vaccine, they prevent the hepatitis D. Also, you need for practice safe sex, blood screening, and safe injection, just as for hepatitis B. Then also hepatitis D now, we get for take care of we water we dey use, since na waterborne and particularly dangerous during pregnancy. So these are some of the things them we go do for with prevention. So we go one for no outside Sierra Leone and then go access hepatitis service system. Can be another question where we want for no. One we go we need for look at vaccination. Now one service now the testing, another one and then treatment and referral. So when you go, you not get hepatitis, you go the first thing is then go get for test you. We're available in many of the well body workplace them. We include the big hospital them, Connaught Hospital, of course na Belema go PCMH, or na young baby then go to na Oladu in Children's Hospital, or Pediatric Center of Excellence, GMB Hospital na Regent Road. You get all them picking hospitals them and Wokupa and all. You get the regional hospitals them. You get the district hospitals. You same also get the private laboratories them where somebody can go for go doing tests for me, you know, which of these available or we present in blood where they go able to identify, or if in or day if then do this test then it proves a negative, then they go advise you for me you go for the vaccine. We go available through most of them place them. Sometimes what's not picking them where they don't born now, salon they under 5 scar then they don't start for give them the hepatitis vaccine as early as possible. So the community health posts, the community health centers, the maternal and child clinics, the government hospitals, the EPI clinics, the private hospitals, and the clinics them, and all of them one day they can able to get the vaccine day after you don't do the test, and then say you negative, then can make it available and then go tell you what it involved. How many doses you get for take and waiting now the time frame for me you do the one day. So I will let you know say you can able for access then services here. And at all if you then go do it now, then it be say you test positive, we are in and go tell you for me you be treated as I don't say earlier on. If not the A and the E, then go treat you conservatively. Doctor will tell you waiting for if now you food for watch, how for wash sham, how for this, how for that. If you for avoid oil first, if you avoid palm wine, butter, you get so many things you go tell you say like curtail on and waiting for improve on, because once you don't get jaundice with that body, the eye yala, you dey pass that stool clay color, you can always not feel for it any of them oily thing, and you not go even get time for digest. So doctor will advise you the best diet where you for take. We will tell you for let you omit fatty foods as at that time until you recover. So they go treat you, and if not B and D you get, then go tell you if they go put you on antiviral drugs, then where they go give the different ones them where they go treat you with, and you go they do follow up. And if need they say outside then go do the test, they're not able for treat you, then they go refer you. So patients will require specialist care, they can refer them to either Connaught or any regional referral hospitals or internal medicine clinics them, or them any of the other side them way them feel say then go refer you near you, or any other side where you go for the appropriate treatment. So no say when you go first then get for do testing, and if they do the testing in negative, then go advise you for taking the vaccine, and then go tell you how far apart you go take them. And also if at all then do them, then see say you get the hepatitis positive, whether it depends which of the letters, then whether na A, B, C, D, and then go know whether na acute or chronic from your history where they don't take, then go advise if you for start treatment. And then if it be said that particular side they're not able for treat you, then they go give you referral from where you go. And so it's advisable that when they give you that referral day, when you come on and go outside, they go able for treat you. Because we don't explain what are the complications if you not treat yourself early and take the complete dose where you don't be infected. It can be challenged because at times silently it progress, the liver they damage progressively, and then it lead to liver failure and all the functions where the liver for do for filter, for support, for produce, for protect, for regulate, all of them things there you're not able for do again, and it get tendency for that even cause pressure or even cause confusion, because the toxins then now don't they take all over the body, don't go na the brain and all of the one day. So now a call to action. The government key messages. The government through the Ministry of Health don't get things the way they don't they do. They go through the 300 days of activism, and also get the 000 events where don't they take place now. All the maternal and child hospitals them. Yet the government still they continue for invest in prevention, in testing, in vaccination, and treatment. So when government do this, you self get the role for go out for be tested, for be vaccinated if you negative, or for be treated if you positive, and also continue for raise the awareness. So we the well body workman them continue for do the screening, and be mindful when they do the screening. Your protection come first. Remember, say you get duty to self, then you get duty to others. So take care of yourself, screen yourself, and see say you free and go and take the vaccines, because you're exposed to patients. There are times when emergencies they come where it will be too late. And also take good care of yourself. So screen and educate, vaccinate, and also continue for advocate for others, for those around, for picking them and all. Then the community leaders, them different positions in the community. Can be bike rider where they lead, it can be counselor, community aid man, you can be all of them one there. So the church leaders, the leaders them at the mosque, and all of them one, and the interreligious council, the council of churches, all of them one, and they for raise awareness and fight stigma. Let them know say people that don't they suffer with liver problem, they not be know, because it can be something silent at times. It can come sometime with the signs asymptomatic, you know, even they know the time where they know you don't late. So the more reason Walter, if you say get malaria, typhoid, you they treat yourself in a well, they treat yourself in a way, they go by the counter, they buy medicine for yourself. Go hospital and do tests and save yourself from thing where go cause you problem. I can always tell people and say the liver and like the steering of the vehicle. If the steering get problem, most cannot they move. So take care of the liver, where another master gland internally way big, where they get so many role for baby. See get problem, they automatically now a challenge for you for they be replaced, because nobody not go and give up himself or say they donate in liver to you. So God don't give you, you know, by a take very good care of you where they drink and all of them things there. So you get for be mindful. You where they overuse some medications, or overuse Panadol. Remember I say paracetamol they in different form. So person want take acetaminophen, take different medicine, and just because you get different, but if you read the content, you get some amount of paracetamol in them. Then also to the schools, the teachers them, Lord, we continue for teach hygiene and prevention, especially why don't pay attention to hepatitis A and hepatitis E, we concerned with food and water. Then also to the parents, they wanna get very important role for play, especially with that picking day now from birth to the 15 months we get vaccines the way they take, and also the booster dose system where they come ensure say the picking take all immaculate them. Make time available. If you too busy, then assign me and go this speaking for take immaculate, because all them immaculate way they make it take they build soldier man against them thing them here. So then belle woman get tested during every belle way you get tested, and if they find out say you get the problem, try for take your treatment, or you not get the vaccine the way you for take, when I try for take. And young people they know your status and protect yourself. Not begin they say life day, life no day. Take care of yourself. Families them, the one that we already don't get the problem, let we support them, let we not stigmatize them. Then to everybody, to we all, let we get tested. If we negative, let we get vaccinated. If you positive, then you take the treatment. But if also you did the treatment, no they then give you referral, honor the referral and go. The media, that we use the power of communication for let we educate, for that we inspire action, for that we reduce stigma, that we promote hepatitis prevention, testing, and vaccination. Because when we do all this, it go difficult for them we go to treatment, because we know say we go don't build soldier man then. So to development partners, the one that we get surrogate for all other organizations for play role in well body business, we will continue for invest in prevention. That will help us strengthen the health system. That will support evidence-based intervention, and that will help communities then for take action against hepatitis. Because when we eliminate hepatitis, now everybody in responsibility. So as government they invest, well body workman and they educate, community they support, parents and they make sure say them pikin and go for vaccination, and we as individuals we know we status, then together Sierra Leone go prevent hepatitis. We go reduce liver cancer, we go reduce liver problem, we go reduce liver failure, we go save lives, and we go achieve a healthier future for all, because it costs a whole lot for send one person overseas for go for liver transplant. So hepatitis preventable, Many cases can be avoided through vaccination, safe health practices, good hygiene, safe water, and early screening. Anyone wey get hepatitis, anyone can get am, but some people dem dey at higher risk, wey include the one dey wey exposed to infected blood, well body workman dem, unsafe sexual practices, poor sanitation, contaminated water, and those who are not vaccinated. So hepatitis B and C na major causes dem for liver cirrhosis, liver failure, and liver cancer worldwide. So hepatitis dey remain silent for many years, so e dey process, e dey go before people dey become infected without knowing it. So early testing and diagnosing dey save lives. When you detect hepatitis early, e dey allow timely treatment and e dey prevent serious complications. So safe water, proper sanitation, hand washing, e dey help prevent hepatitis A and hepatitis E. So every belle woman na for try for be screen for hepatitis B for let reduce transmission from mama to pikin. Government, community, family, individuals, or everybody, let we try for know we status, let we get vaccinated, let we get after we don get tested. If for any reason positive, try for get treated and complete your treatment, because this na the most effective step for protect we self, for protect we family and we community. Remember say hepatitis is silent but na preventable disease. No wait until symptom appear. Know your risk, know your status, get tested, get vaccinated, and seek treatment early, because together we go prevent liver disease, we go reduce liver cancer, and we go eliminate hepatitis as a public health threat na salon. Let we protect we liver, let we protect we family, and let we protect we future. Remember say today we understand hepatitis, we protect we liver, and also protect we life. Till next week, me will bring the program come na Gifty Massacre, and you go get an opportunity for get a repeat session on this na radio 7 o'clock this evening time. You will miss any part of this program, you go get them live na Well Body YouTube page. Till next week, I left on now in the name of the Father and of the Son and of the Holy Spirit. Amen.